Hi, my name is Miriam Galindo, and I'm going to present on Vernon Hawthorne. Patient is a 55-year-old heterosexual Caucasian male, otherwise in general good health. He's a Stanford graduate, self-employed attorney. He prefers he and him, and he presents today for a sick appointment. Patient reports that he's here for a cough, and he wants antibiotics to kill it. Symptoms include dry, non-productive cough, runny nose, and sore throat for 3 days. He denies any precipitating illness, to his knowledge. Frequency of cough is continuous, and in his words, every 5 minutes, which is interfering with his sense of productivity. The location of the cough is in his throat, as if he can't clear his throat. By contrast, there's no tightness in his chest, no bloody or purulent sputum, no fever, and the patient denies any alleviating or aggravating factors. He has no history or current evidence of any allergies, no TB, GERD, COVID, headache, or sinus pain. His medical and surgical history is unremarkable. He's not taking any medications or supplements currently. He doesn't smoke, he doesn't use illicit drugs, and his alcohol consumption is non-contributory. Based on his description, there is no exposure to toxic substances, and he denies any asthma-like exacerbations while engaged in physical activities. His review of symptoms is unremarkable, and upon examination, all vitals are within normal limits. Aside from the slightly erythemic oral pharynx, his physical exam is also unremarkable. I've diagnosed him with post-viral upper airway cough syndrome, formerly known as postnatal drip. My differentials were as follows: GERD, cough secondary to an ACE inhibitor, which he's not taking, TB, asthma, allergies, non-asthmatic eosinophilic bronchitis. However, as I mentioned before, all of these were ruled out in the interview and in patient examination. So my plan, based on the provisional diagnosis that I gave him, is to provide education on the futility of using an antibiotic, since bacteria is an unlikely source of this patient's symptoms, and then to provide him with a something that we could mutually agree on together, since clearly he is invested in his own health and wants to be in charge of what he puts into his own body. My first thought is a prescription for benzonatate, 100 milligram capsules, and I would instruct him that you need to swallow these, not chew them or break them in your mouth. And my prescription would be 1 to 2 capsules by mouth up to 3 times a day, PRN for a cough. I would also instruct him do not exceed 600 milligrams per day. If this is not acceptable to him, the other suggestion would be an over-the-counter liquid cough suppressant medication, such as Robitussin Maximum Strength Nighttime Cough DM. And I would suggest 20 milliliters by mouth every 6 hours, preferably at bedtime. In addition to these 2 cough remedies, I would suggest some things he could do at home, starting with moisturizing saline rinse to expedite the symptoms of runny nose, gargling with saline water as needed 3 times a day to help with symptoms of the sore throat. He can use sugar-free cough drops. I would also encourage him to take in plenty of fluids, up to 2 liters or 2 liters of water daily for hydration. Sleeping with a humidifier at night, getting plenty of rest and sleep, and to please stay home so that he doesn't spread the infection. And as far as a follow-up appointment, I'd be disinclined to ask him to come in. He, for several reasons, one of which is he is a very busy man, and I want to respect that. So I would suggest to him a telehealth appointment in 1 week to assess his symptom status and determine whether or not we need to revise the treatment plan. And again, I would want his input. I think it's important for this man in particular that he feels like the treatment plan was mutually derived. And that's it. Thank you.